Hi, my name is Bianca Martinez, and I'm going to be going over our week 3 assignment, which is to choose a gastrointestinal disease and break down how it is diagnosed, treated, signs and symptoms, and common medication and patient education that should be given depending on the condition. There are many different types of inflammatory bowel diseases, and the one that I decided to speak on is Crohn's disease. It is a chronic long-time condition causing inflammation to the lining of the digestive tract. And Crohn's can commonly happen in any part of the GI system, which can begin from the mouth all the way down to the anus. Diagnostic testing that is likely to be done is going to be like any other medical condition. The physician is going to want to begin by completing a full physical of the patient, and depending on his findings, he is going to likely order some blood draws. And before that is done, they also want to have any previous medical history. And one thing that they're definitely going to look out for is if there's a family history of GI issues, if they're having any of the common symptoms like chronic diarrhea, vomiting, severe abdomen discomfort. There are different types of scans that can also be done. A CT and MRI will show a closer picture of what is going on, not just between the organs, but they'll be able to see if anything is inflamed or there's punctures anywhere, like an ulcer. The physician will be able to see the damage that it has done to the part of the certain intestine. And for Crohn's disease, it is also likely that they will be recommending to do an endoscopy, which shows a video picture with a small camera that's inserted through the mouth all the way down to the anus, and it will allow the physician not just to see a clear picture, but like in an in-life real picture, to see if there's any swelling, bleeding, and just anything abnormal that you would not find in a patient that doesn't have any GI issues. Clinical manifestations of Crohn's is pretty common. It will be severe abdomen pain, also cramping. For some, there may be experiencing mouth sores, severe weight loss, and with that weight loss comes the fatigue. One major sign to look out for will be if there is blood in their stools, and also a fever. The blood in the stools can be concerning, so if the patient is experienced that beforehand, that would be a symptom that they immediately want to reach out to their physician. For interprofessional care, patients with digestive issues commonly see a gastroenterologist, GI doctor, known as short. Like I said, there's many different gastrointestinal diseases, so these physicians have a better understanding of all the different types, what to look out for, and how to benefit the patients that are suffering from GI problems. Treatment and medications will vary. There is no cure for Crohn's disease, and treatment will be different for every single patient. Not all medications will work on the patient. Like I said, depending on the severity of their symptoms, certain medications might not work for them like they have worked for other patients. Treatment is likely going to begin by the physician and the patient trying to identify what is triggering their inflammation, like their GI inflammation. This can help the physician and patient identify not just what is causing it, but how to prevent it from getting to that point. Medications that are likely going to be prescribed for a patient with Crohn's disease is anti-inflammatories. This will obviously help any inflammation going on within the body. These are not just used for an injury type inflammation. Another medication that is recommended for Crohn's patients is immune system suppressors. This medication targets our immune system specifically and identifies inflammation that is going on within the body, helping the immune system fight it off and recognize it. And other medications likely to be prescribed to any patient with GI problems is antidiarrheals and pain relievers, and that pain reliever will be for the abdomen pain or any other kind of discomfort the patient is experiencing. Plan of care for a Crohn's patient can be finding relief for the diarrhea. And the nursing diagnosis is related to diarrhea. Diarrhea is related to the inflammatory process. Client outcomes that will be expected for a patient with Crohn's experiencing diarrhea is for them to receive relief from the cramping and abdomen pain. Also, we want these patients to maintain good skin turgor. With the diarrhea, they are at risk of becoming dehydrated. And also, they want another client outcome is to have a more form stool, at least between 1 to every 3 days. Nursing interventions for diarrhea is going to be assessing the pattern of the defecation, meaning monitoring when it's a diarrhea form or they are a little bit more solid. Also, the nurse is going to want to be inspecting, osculating, and palpating, also percussing the abdomen just to see how the bowels are acting. Patient education for a Crohn's patient is to encourage them to avoid coffee, caffeine, and any milk products that can aggravate GI issues for them. If they consume these products, for some people it causes more abdomen pain or just even more diarrhea to be occurring. We want to make sure we educate the patients of understanding the use of antidiarrheals and the possible side effects to any medication whenever they are prescribed. That way they know what to look for if they may be experiencing any allergic reaction. Also, ensure the patient understands any stressors that can aggravate their, not just the Crohn's disease, but just any GI issues they may be experiencing. Another important component to teach our patients with GI problems is to ensure they understand signs and symptoms of dehydration. Diarrhea, we are getting rid of that fluid that we are using to hydrate the body. So with the diarrhea, we're getting rid of it way too fast, more than what we can replenish it with. So teaching patients signs of dehydration will be crucial to ensuring they are always maintaining a healthy status with their hydration. And that is my video on Crohn's disease. Thank you.